Singapore will remodel its COVID-19 healthcare protocols as the disease becomes endemic. This is to ensure the healthcare system does not get overloaded. Healthcare Minister Ong Ye Kung says the shift has already started thanks to high vaccination rates. Shortening explains.
When COVID-19 becomes endemic, it would not be unusual for Singapore to have 200 or more new cases a day. If it carries on to treat the virus the same way, the healthcare system would not be able to cope. Therefore, healthcare protocols have to be remodeled.
We cannot carry on with the current healthcare protocols. They need to shift closer to how we treat influenza today, without extensive contact tracing and quarantine in dedicated facilities, and hospitalizing only those who are very ill. But that can only happen when the likelihood of developing very serious or life-threatening disease as a result of COVID-19 infection has been significantly reduced by effective vaccination of our population, especially amongst the vulnerable.
And with Singapore's current vaccination rate, transitions have already begun. First, a greater use of community care facilities. Vaccinated people aged between 45 and 59 who get infected and show mild or no symptoms can be directly admitted to such facilities instead of hospitals. It's already been practiced for patients aged 15 to 45 years old, with the expansion to now include those up to age 59. As much as 60% of infected cases are expected to recover in such facilities, and the government's looking to bump that number up to 80%. Second, reducing patients' length of stay in healthcare institutions. Now, fully vaccinated persons are being discharged from isolation after 14 days with a 7-day leave of absence. And with studies showing that the viral load in vaccinated people falls to very low levels after 9 days, the government's reviewing to see if patients can be discharged even earlier. Thirdly, greater use of home quarantine.
For fully vaccinated persons, they can now serve their quarantine at home instead of a dedicated government facility, provided that their home is suitable for isolation. We expect up to 40% of persons under quarantine can serve their quarantine at home, and this will go beyond 50% in the coming few weeks as more people get vaccinated.
While daily infections have gone up in the past few weeks, the number of patients who require oxygen support or critical care remain low. Mr. Ong says all these cases are either partially or not vaccinated. And it appears that Singapore has weakened the link between infections and severe illnesses, thanks to vaccinations. Singapore's vaccination rate is going up by about 1 percentage point each day. By early September, it should reach 80%.